So good morning everyone. So I hope na energized namong tanan and ready namong to listen sa among lecturette about sa dengue. So i-discuss nato ni kay commonly ni siya makitaan sa na problem sa atong community. So together with me is Ma'am or PCI Miss Blazel. Blazel Dugiles. So for our introduction, next slide please. So a mosquito-borne viral disease called dengue virus has been rapidly spreading throughout all regions in recent years. And it has also been consistently emerging throughout the tropics with a local variation at risk of influence such as rainfall, temperature, relative humidity, and rapid urbanization. So the dengue virus transmission comes from a female mosquito predominantly of the species Aedes aegypti and less commonly lang siya sa Aedes albopicus. So these two are caused by a virus belonging to a Flaviviridae family. So there are four serotypes of our dengue virus, so the DNV1, 2, 3, and 4 that cause the disease in humans through the transmission of mosquito vectors, as dengue causes a broad spectrum of disease that ranges from subclinical disease up to severe flu-like symptoms with the infected that is potentially lethal complications. So during the 1950s, with a surge of dengue epidemic in the Philippines and in Thailand, severe dengue, commonly known as dengue hemorrhagic fever, was first recognized. And today, Asian and Latin American countries have been most affected with dengue hemorrhagic fever, becoming a leading cause of hospitalizations and death among both children and adults. The dengue's global incidence has grown dramatically in recent decades, and it has had an alarming impact both on humans' health and on the international and national economies. So next slide, please. So for our statistics internationally, in the United States of America since 2010, dengue has become a nationally reportable disease. So the majority of their dengue infections are from imported travelers from areas with endemic transmissions and few outbreaks secondary to indigenous transmission. So the Centers for Disease Control and Prevention has analyzed the reported cases starting January 1, 2010 to December 31, 2017. So among the 50 states and the District of Columbia, so a total of 5,387 dengue cases were recorded. 9% of those patients have travel associated, while the other 7% was a local transmission. With the data gathered, it has demonstrated the ongoing risk for local DNV transmission in Aedes infested areas. So despite the emerging height of dengue cases, there was still no specific antiviral treatment for dengue fever. So therefore, avoiding being bitten by mosquitoes remained the most effective strategy in preventing dengue. Also, doing particular measures in reducing the chances of infection, such as using insect repellents, wearing long-sleeved shirts and pants, and putting structural barriers like screens. So avoiding breeding sites of mosquitoes also decreases the chances of insect bites. However, in May 2019, the use of the live attenuated tetravalent vaccine called Dengvaxia has been approved by the Food and Drug Administration. So the vaccine will be administered as 3 separate injections. So after the initial dose, the 2 additional injections are given 6 and 12 months later. For the national statistics, so here in the Philippines, the risk of dengue has always been present. So the country's transmission occurs year-round, and its peak of transmission is during rainy season that usually starts May hanggang November. So in the year 2020, the Department of Health has recorded dengue cases in above all the areas all the areas. So Negros Occidental province had the most number of dengue cases with 1,201, followed by Iloilo province with 648 dengue cases. There were also 494 dengue cases in Aklan province, 406 in Antique province, 346 in Capiz province, 231 cases in Iloilo, 219 cases in Bacolod City, and 91 cases in Guimaras. So escalating the height of dengue cases in the country, the DOH, or our Department of Health, has reminded the public about the 4S campaign against dengue. So ano-ano itong 4S campaign natin against dengue? So next slide, please. So first S is to search and destroy mosquito breeding sites. So second one is to secure self-protection measures like, again, wearing long pants and long sleeves shirts, and using mosquito repellent. So the third S is to seek early consultation. And lastly is to support fogging and spraying only in areas where there is an increase in cases that is registered for about 2 consecutive weeks to prevent an impending outbreak. So this campaign had called everyone to become prime movers in controlling and preventing any possible dengue deaths within the country. So the health secretary under Aquino administration before has also emphasized that the first step in preventing dengue is to start within our homes, and it is important to remove any space or container that can hold unnecessary stagnant water that may become breeding sites of mosquitoes. So locally, here in Davao City, aside from preventing the diseases coronavirus in 4 simple ways, the Davao City Health Office has also reminded Davaoenos to religiously practice the 4 o'clock habit or the 4S strategy in fighting against mosquito-borne diseases such as dengue. So data from the Davao City Health Office Tropical Diseases Division recorded that at least 1,193 were recorded cases in 2020 that are around 50% lower than the cases in 2019. So with Davao City adopting the campaign of the 4S, it has been continually progressing to encourage the community to be aware of the movement for everybody to participate and decrease the chances of infection of dengue virus. The City Health Office has also intensified its spreading of information and education campaign against dengue fever. More importantly, CHO has considering large area and the number of population within a region as due to large number and change of climate have aggravated the problem. So in Barangay Kabantian, I'm not sure if inadequate pa din ang water supply until now kasi 2019 pa yung statistic. So Barangay Kabantian daw in Buhangin is at high risk as they have to store water due to the inadequate water supply. And even today during the pandemic, still the CHO has emphasized not to neglect and yet campaign for ways to prevent the dengue virus. So next is, what are the factors that contribute to dengue? So we have 3: the age, gender, and race. So for the age, children are among prone to dengue as they play outdoors and are not aware of the complexity of mosquito bites. So this is also why the CDC recommends dengue vaccination to children aged 9 to 16 years old para ma-prevent ang hospitalization or severe dengue effects. However, these days, common na siya sa all age groups. So for gender, according to Prasit, young females tend to have a higher risk of dengue due to the genetic, immunological, and hormonal factors that determine the susceptibility to disease. Also, females are less affected because they have a more vigorous immune response to infection than males, because they have produced lower levels of inflammatory mediators and mag-reduce sila ng systemic inflammation due to the production of immunosuppressive molecules. And for the race, so it is commonly dengue is found in tropical and subtropical countries. So the ethnicities that are most seriously affected by dengue are Pacific Islanders, so Hawaii and the Samoans, the Latin Americans, so the Mexicans, and especially Southeast Asians as Filipinos. So for the precipitating factor, Miss Blazel will be report.
Okay, so good morning. For the precipitating factors, we have the Flaviviridae family. So it is a family of positive, single-stranded enveloped RNA viruses that can occasionally infect humans. So this family consists of a flavivirus genus that can be transmitted by a mosquito that can cause severe diseases such as yellow fever, a type-specific virus, and also dengue fever. Next, we have the female Aedes aegypti and Aedes albopictus. So the first picture is the Aedes aegypti, and the second picture is the Aedes albopictus. So the Aedes albopictus is also known as the Asian tiger mosquito. So ang ilahang differences lang kay makita ninyo sa ilahang ulo kay ang kaning Aedes aegypti na siya duha ka spot sa ulo, then ang Aedes albopictus is single lang inyahang line. So these Aedes mosquitoes are predominantly highly efficient mosquito vector for the dengue infection. So in addition, Aedes mosquito species have adapted well to human habitation, and it requires a blood meal as a source of appropriate protein for their egg development. Then last, for the precipitating factors, we have the environment. So dengue is widespread throughout the tropics, while local variations in risk influenced by rainfall, temperature, relative humidity, and unplanned rapid urbanization. So the dengue mosquito, nagalay sila og egg sa kanang mga container nga matambakan og water. So example ani kay ang mga used bottles, mga tires, even mga pots, kanang mga dulaan sa mga bata, mga trash containers, buckets, mga balde. And adult mosquitoes usually rest indoors in dark areas such as the closets, under beds, behind the curtains. So, dito sila nagatago kay protektado sila sa hangin, sa ulan, and mostly sa mga predators or kanang especially sa mga tao no nga mapatay sa ilaha. So, dito sila kay para mag long live sila dito and pwede po ma-pick up dito ang virus, so from one person, and it can be passed to the next person. Next slide po, we have the symptomatology. So first is the bleeding in the gums or the nose. So acute gingival bleeding can also be caused by dengue fever. Periodontitis can be significantly impaired by blood or blood-forming organ disorders. So it is an indication of an underlying bleeding disorder, which is the most prevalent ecchymosis and petechiae in the soft palate region. Then we have the bleeding under the skin. So serious dengue is characterized by severe dengue fever symptoms, which is followed by bleeding from the gums, nose, intestines, and internal organs. So there may also be swelling and patches of blood under the skin, and pneumonia and heart inflammation may also occur. Then the blood in the urine, stool, or vomit. So among the various causes of hematuria, there is a significant reason, which is the bleeding disorder. So the infection-induced hematuria causing bleeding disorders include na dito ang dengue fever, which is a specific viral infection. So if ang patient na siya dengue hemorrhagic fever, na ay bleeding mag-occur sa skin, gums, and sa nose, and may also vomit blood or transfer blood sa stool sa patient. Next, the cold or clammy skin or the shock. So the absence of blood circulation causes damp, clammy, bluish skin to be present in the patient. So ang shock-related patients may look restless and their blood pressure and pulse may be undetectable. So severe dengue can also cause other organs to suffer from respiratory failure and injury. Then the difficult or rapid breathing. So there was a study na ay 17.8% patients with dengue fever kay ang present sa ilahan na symptom is breathlessness. So breathlessness may occur due to the pleural effusion, acute respiratory distress syndrome, pneumonia, metabolic acidosis, and dengue fever. Then next po, we have the fatigue. So there was also a study na nag-indicate kapag na-inflammation, kaya ang symptom is fatigue. So labi na kapag viral infection, so viruses cause them to react and attack the immune system. So this reaction causes stress and inflammation in the body. Then irritability or restlessness. So if in use of medications, kay it may also happen, the irritability or the restlessness. But often, ang agitation ang caused by a medical condition, no? Mo ang ilahang mapakita na signs and symptoms, which is the agitation. So if na ay hormone issues ang patient, it is pretty normal to feel unsettled. Then the persistent vomiting. So when in sick with an infectious illness, this may lead to vomiting. So the lining of the stomach or the gastrointestinal tract is normally inflamed and irritated. Then last is the severe abdominal pain. So a rare and frequently clinical misdiagnosed cause of abdominal pain is rectal sheath hematoma. It is the effect of bleeding from damage to the superior or inferior epigastric artery or its branches into the rectus sheath or direct tearing of the rectus muscle. Next slide po. So we have the health teachings. So if any family member is suffering from suspected dengue fever, it is important to carefully watch a relative for the next few days. So since kanina disease kay rapid na siya and pwede maging serious na and lead to medical injury. So ang complications that associated with dengue fever usually appear between the 3rd and 5th day of illness. So the family or patients should watch the person or the family member na ay dengue fever for 2 days even after the fever disappears. So here are the do's and don'ts of patients who have dengue fever. So first, wala dyan specific treatment for dengue fever. So the over-counter or the OTC drug, acetaminophen, can help reduce muscle pain and fever. So it is better to keep body temperature low and drink paracetamol. So give the patient paracetamol not more than 4 times in 24 hours. So na I prescribe doses. So age less than 1 year old, maghatag ta og 60 milligrams per dose. So ang tablet ani kay na siya 250 milligrams. So ang ihatag is 1/4 sa tab. Then ang sa 1 year old to 4 years old, 60 to 120 milligram per dose. Ang tablet, 250 milligrams, same pa rin. So ang ihatag is half sa tab. Then kapag 5 years old and above, 240 milligram per dose. Then isa na siya katab. Next is, while recovering from dengue fever, encourage na to ang patient na mag-drink of plenty nga tubig, then mag-complete rest pod kay. Labi na kapag ang patient kay nanas lagi napakita nga symptoms of dehydration such as decreased urination, few or no tears, dry mouth or lips, lethargy or confusion, and cold or clammy extremities. Next, for the family teachings sa family members, and also pwede po na siya sa patient, no? So, encourage nato sila na mag-wear of long sleeve shirts and long pants and apply insect repellent. Makaprotect na sa family and sa patient from mosquito bites and to avoid po dengue fever. Labi na if matulog kay, di ba, mostly maumana na time na daghan jud og mamaak na lamok. Labi na sa mga bata kay mag-off na og lights ang balay. Then next, control mosquitoes inside and outside the house. So the family should always check once a week ang kanang mga matambakan og tubig, labi na mga empty scrub, mga buckets, mga ligid, kanang mga butanganan ay mga pots, then mga balde, mga planggana, kay labi na kapag ting-ulan, tambakan jud na siya og tubig, labi na kapag dili gina check, gina monitor sa family. And yes, tama pag na-mention ganina ni Sir Ruark na diri sa kabantian jud kay dili pa okay ang tubig, night times na mawala jud siya. So mga family jud diri, mga households kay nagatambak jud sila og water sa balde, and naiuban kay kanang mga drum nga walay cover. So itlogan jud sa mga lamok. Then also i-check pod ang mga parts sa balay nga kanang tapukan sa lamok. As mentioned before, katong sa baba sa kama, sa mga cabinets, baba sa lamesa, kay dira po na sila mostly kay ngit-ngit and wala kaayoy kanang dili kayo ma-spot sa mga tao. So dira na sila magtambay. Then pwede po i-encourage nato ang mga family nga magamit og screen sa ilahang bintana, sa ilahang portahan para dili makasulod ang mga lamok. And kapag naay buslot ang screens, then ipa-repair na lang po nato siya kay para kato dili makasulod ang mga lamok sa balay. And we have the don'ts. So do not take aspirin or ibuprofen. So ang kanina mga drugs, other OTC pain relievers, kay pwede na sila maka-increase sa risk of dengue fever bleeding complications. Then do not wait symptoms that may appear. So consult physician as early as possible. Labi na itong mga family nga nag-travel sa known na endemic area and nag-display sila og symptoms sa dengue infection. So magpa-consult jud diretso sa physician, and do not wait symptoms to appear kay dili na kay basig wala ta kabalo nga ang symptoms dai sa ato ang patient is kanang for severe na di ay siya. So dapat maagapan dayon siya para matreat pa ang ato ang patient. And that's all po sa health teachings.
And lastly, run through lang tayo sa pathophysiology ng dengue and how it occurs. So again, ang dengue fever or DHF starts from the bite of a female infected mosquito, yung Aedes aegypti natin. So from the bite of mosquito, yung portal of entry from the skin, so it allows the dengue virus to inoculated in the circulation or blood. So incubation period is about 3 to 14 days. So pag meron ng dengue virus na nag-circulate sa ating body, so rapid dissemination of dengue virus in the blood and stimulate the WBC. So anong gagawin ng ating body? So ang gagawin ng ating body is mag-trigger siya ng inflammatory response. So yung ating immunoglobulins or ating antibodies attached to facilitate phagocytosis. So ano gani yung phagocytosis? Develop pa maanang phagocytosis. So it is the ingestion or the engulfing of bacteria or other material by phagocytes. So pag na-attach na or na-facilitate ng phagocytosis, yung macrophages and monocyte natin phagocyte the dengue virus through Fc receptors. So yung main na uh, na i-infect ng dengue virus is yung ating monocyte and phagocyte and macrophages. So pag na-infect na ng virus yung ating mga WBCs, so virus replication takes place. So it multiplies and released to the bloodstream. Thus, yung symptoms natin of dengue fever develop. So yung dengue fever natin includes yung nausea, vomiting, rashes and pains. Typically yung eye pain, behind the eyes, muscle pain, joint pain, or bone pain. So after mag-replicate and multiply and na-release na sa bloodstream, mag-release na ngayon ang ating mast cells or basophils ng histamine. So pag na-release ng histamine, mag-increase ang ating capillary permeability, thus resulting to plasma leakage. So yung plasma leakage natin is mahirap itong i-identify. So nagagamit tayo ng ultrasonography to check for the plasma leakage. So if meron ng plasma leakage, so doon pa lang madedetermine natin na merong dengue hemorrhagic fever yung patient. So signs and symptoms natin for dengue hemorrhagic fever again is difficult or rapid breathing, bleeding under the skin, gums or nose, irritability or restlessness, severe abdominal pain, persistent vomiting, blood in the urine, stools, or vomit. So nursing management natin to manage the symptoms and keep the infection from becoming more severe. So severe cases may need emergency treatment such as yung hydration with intravenous fluids, OTC or prescription drugs to manage the pain, electrolyte therapy, blood transfusions, careful monitoring of blood pressure, oxygen therapy, skilled nursing observation. So all of these methods are aimed at controlling and alleviating symptoms while helping the body heal naturally. So for our prognosis, if treated, so good prognosis siya. So the patient must show normal vital signs, the absence of bleeding under the skin, gums, or nose, the absence of blood in the urine, stools, or vomit, normal breathing pattern, no episodes of persistent vomiting, relief from irritability or restlessness, and relief from severe abdominal pain. So if not treated, it will lead to poor prognosis. So critical condition would arise. Meron din including dito yung dengue shock syndrome natin, and lastly is death. So that's all for our report on dengue fever. Thank you all for listening.
Okay, thank you PCI. Okay, nasabtan ba level 2 ang lecturette? Doon na sila yung mga dito portion na sa gawas no, international but it's okay. So pareho lang man din no. So ang dengue fever nowadays diri sa Philippines no, diri sa Davao, okay, rampant pod ang cases, okay? So na-mention man ni Miss Dogiles ang mga health teaching dito. Okay, na ano ra, simplify ra, okay ra? Ma'am siya. Pwede ra ni sila ma'am no, makita sila dito like kanang during sa ilang interview ba makita sila mga murag na tubig dito na plastic ba?
You can include that one.
So problem na siya nga identified problem na pag namoy makita ang mga inana no, na tapok-tapok dito nga na mga tubig no, mga inana. Dili na ta ka sharing? Naman.
Pwede man siguro.
10:44.
Pwede ugma na lang ma'am kuan. Anyway, we still have the the health teachings that was given can be used para sa duty ha. So I do hope that you have list down, no, what you can say. Automatic ha, ayun naghulat na si day 2 implementation. Pagkakita pa lang ninyo, diretso na kayo, pwede na kayo magsabi doon kung ano pwedeng mga ano. Kaya pwede ninyong maturo sa kanila immediately. So you can have a very short term FNCP for that. Okay? So pwede nating ipasok doon sa yung mga hazard na mga ano sa kanila. O nakabalo, tinuod naman yun na kahit ulan na baron, no? So we don't know kung saan sitwasyon dito sa area. Okay, we still have more topics for the lecturette. We have for my group, ano sa line topic din mo gani, ma'am?
Kuan, leptospirosis, weight segregation, malnutrition.
Okay, so we have 3 more topics from Ma'am Magrinyo and have 4 para sa akin. Okay, so we cannot have anymore the sharing kasi nagipit kay anyway 2:30 pa man kayo, we can extend a little. Pwede tayong I do not know if you already made your aras for the day. Okay, probably we will give you the time now. The time now will be given for aras making. You complete all your aras for today. We will give you the idea. Tomorrow will be EPI plus GDM and PIH probably for my group, and then another one from Ma'am Alma. So we have 3 topics. Para
Ano man ma'am, leptospirosis na lang.
Pwede, leptospirosis. Pagka third day natin, we'll have
Weight, weight segregation, malnutrition.
and I still have filariasis and schistosomiasis.
Sige. O pat sa Saturday. Okay.
Wala naman tayong lecture sa Saturday na atin. Sila na lahat na to sila dapat ka-topic. Okay, so take note of those schedule so that you can prepare ahead of time your daily plan of activity para sa ating aral natin, ha? Your aim, that is purely combination. Then, if we still have time, we can have kasi short tayo sa Saturday hanggang alauna ang exam ninyo, so mahulog na earlier na mag-dismiss. So, magbanat na for the next 2 days. So, mo na atong paspasan karon, so at least natay isa ka topic natin DOH program, so dili na dehado natay the more that we can prepare. Kung hindi makaya the other lecturers will be given by next week after, but the goal is to finish all of them for this week. Okay?
Mubo lang man ang ma'am siya, ang API mubo lang siya.
Mubo lang siya, so makaya ra isip tulog ka topics tomorrow. Makaya
okay, mubo lang siya, and then ma-appeal pa na siya sa 204. Pag sa midterm ata siya, oo.
So makaya ra sa cover.
More on health teaching, di man ta makaano, no? Dili
Dili
ta lang mag-inject.
O dili ta lang inject. Katuan lang is for them to have the idea.
Oo.
Kasi kung when you give the health teachings doon, pag-abot ito, kabalo mo sa isulti ninyo o sa panuslok dito sa mga bata. Like when you check their card ba, yung mga bata, yung record nila, alam niyo anong sabihin yung sunod. Ma'am, lang kaani magkuan ka balikin na siya yung analysis, so at least you have the idea na mo ikasulti maski wala pa mo it seems like you are really prepared and dating ka na pinagdaanan ng topic na yun, so para in preparation for our health teachings there, the more that we can teach them, the better. Okay, so we will give you the last, we'll end at 11 o'clock, mga 15 minutes to do your complete your aras. Ay, ma-exam man sila sa ma'am, no? Pwede natin ma-collect sa Wednesday ang ilang aras?
Wednesday next week?
Sorry, Wednesday ako. Saturday,
Friday. Karon na week.
Pagka Saturday, pag dalahon nila sa school ba? Pa-submit na to, tapos kuhaon na ulit nila, mag-ready lang sila sa nila and activity, i-rewrite na lang nila pagkakuan. Pagka Thursday next week, kuhaon nila sa Thursday 1 na to.
Sa dalawa na to ang notebook.
Dalahon nila ang notebook sa Saturday.
Paon na
to dito. Pasabit na to sa faculty.
Okay. Tapos ibalik na to next week.
Paon na po nila sa to Thursday. Pag-meet
Thursday, pag-meet. Oo. Pwede,
pero
oo.
ready na nila daan na ilang isulat dito na aim for the week. Yung weekly tapos ang kuan. ang activity for the day. O, so, magunitan niya po na ito notebook nila.
So, pwede ra Saturday.
O, kaya na Saturday. So, we'll collect it on Saturday, ha? You will all be in school by 1 o'clock. Okay, so after your exam, bring your notebook, submit it to us. I'll be in school until 4 o'clock. Mga 4:30 siguro, hanggang 4:30 nandun ako.
Ang PCI na lang ating ipa-collect, ma'am,
Ay,
siya.
pa-collect sa PCI, pwede sa PCI na lang mo hatag para kompleto. Okay. So, you start
Para
working.
di magdumo.
Okay. You start working on the
Ang ma'am siya, ang health deck, basig dili ma-open kung ako ang musen. Kung ikaw
Dili.
musen, ma-open ka.
Dili sila maka-open. Mag-submit lang sila sa declaration. I-send ako sa mga responses para ma-abri nimo.
Kay nag-try ko ako siyang gi-forward, dili din na ma-open.
Dili. Ang i-forward nimo to kay mo to lang answeran. Pero kay i-open imo ha. I-send na ko sa imo ha. Wala day ang kuan na sa imo
Murag
answeran.
may nag-try si Mr. Salido. Di ka ka-open?
Nakabutang lang ma'am kay i-edit lang ang response kasi na-fill up na po.
Yung yung papilapan sa inyo, di ba?
Oo.
Yes, ma'am.
Right. O kami mag-check ng kung sino ang wala. Kasi dapat actually private na siya dapat. Hindi siya dapat makita ng mga classmates niyo. We will send it. I'll send it to you, ma'am.
Sige, ma'am siya.
Yeah, kung pang taon. Ang responses.
Okay.
I-check ka ron kung gusto ka makuan. Kaya kung i-send na dahil kayo sa mo ha. Kalimut kong send sa responses mo. Mo itong naka-table na imong tanawon. I-open daw. I-send na namin ron. Kapag nagasulat-sulat sila.
Nag-send na ka? Sige,
Nag-send
open
ako.
ako.
Sa mga petsa ron. $14 karon today. Ano yung nag-send karon? Hamero sa Caldito versus Salazar Flores Tagadayan. Ikaw ang proctor nila ron.
Si Kuya Soriano. Third year ko karon.
Dili ni sila.
Oo,
Dili
dili
man ni
sila.
sila karon. 15 naman din karon no.
Kita ra gyapon ang ma-assign kay ang man CI man sa RLE. So kada exam ani nila ma'am siya, kita ang mo health deck. Kada akong pagsabot. Oo. Kay kita man ang ilang RLE nga CI.
Wala man nag-ano sa exam man sila mo. Dapat dito sa exam sila magpatanaw.
Murag
Sila may katubang dito. Ano kita may dili man kita makatubang sa ilaha katubangon na to ang atong tanawon para makasita ta og
dili kita inaana lagi akong pagsabot. Kita ang ma-assign tanawa ra gud tong memo. So kitay kani section R. Ang ilang R, di ba RLE, di ba RLE CI nakabutang dito? Kinsay mag-check sa kinsay
pagbutan po daw siya sa school. Amo adto sa school mo na mo check kay malay nag-check ta unya dili malay ba nato kinsa ang katubang dito no.
Mo to gahapon ma'am siya.